So my name is Alex Slaby. I am a fourth-year psychiatry resident at the Wright Center. Psychiatry is a medical specialty in which a doctor is trained to treat specifically psychiatric disorders.
Depression, anxiety, substance use problems. In children, we see conduct problems, ADHD, and other behavioral health problems, school problems, relationship problems with peers or family. So this deals with overall mental health of a person. Basically, psychiatrists can prescribe medications. On the other hand, psychologists, therapists, counselor, they do more of the talking therapy. So they do not prescribe medication. That's a big difference.
We're also trained to do psychotherapy, so it's something we can do as well. So we do a combination of both.
Some cases are more of medication-oriented cases. So we will be spending out of 30 minutes, let's say 20 minutes talking about medications, or 15 minutes. And then we can talk about other issues and spend some time in therapy. And we give them the options of different medications. We let them decide what they want to do. Some patients, they are not sure during the first visit, so they'll go home, talk to their family and friends. And some patients these days, they want to read up on these medications. We provide them the handouts, and so that they can make an informed consent and come up with a plan.
As far as getting connected with a psychiatrist, there's multiple ways. You could do it by reaching out to the practice directly. A lot of times at the clinic here at the Wright Center, we get people that are referred from their primary care physician, usually after they've tried quite a few medications through different doctors and they want more thorough evaluation.
If someone is seeing a therapist or a counselor and they think patient needs medication, they can refer to a psychiatrist. In children and teenagers, sometimes school counselors or school coaches, teachers, if they notice any behavioral health problems.
Inpatient and outpatient psychiatry are two different things. I would say in the hospital setting, people are going there more for acute emergencies. These are situations in which their life is at stake due to the illness that they're suffering from. So usually in a hospital setting, people will have treatment started much more quickly, things will move a little bit faster. In the outpatient setting, it's more of a longitudinal treatment where you get to establish with somebody you hopefully have a connection with, and they do an evaluation where they talk to you for weeks and months and get a better understanding of what exactly might be happening and how medications or certain therapies might be able to help you.
Inpatient psychiatrists would be dealing with acute situations, acute crisis, for instance, suicidal thoughts. However, outpatient psychiatry would be more stable patients. More patients I have seen, they start with outpatient, and if some crisis situation comes up, they need to go to the hospital or the ER.
There's no hard and fast rule as to when somebody should see a psychiatrist, but in general, I would say when a person starts to feel very overwhelmed or has very intense emotions or feelings such that it's interfering with their ability to do day-to-day things, it would be probably a good time to establish care with a psychiatrist.
Say to general population, if they know someone or someone in their family struggling with the depression or anxiety or any change in behavior, if it is too severe to handle, then seek your medical help, and that's how they can get referred to psychiatrist, or they can just call our clinic, Wright Center Behavioral Health, and we'll see you in our clinic.